The availability of naloxone absolutely does not encourage drug use, and actually the proliferation of naloxone at an individual level, at a community level, actually decreases the likelihood of fatal overdose. So most overdoses are reversed by laypersons, but we have seen naloxone present in EMS and ambulances since the 1970s. So putting naloxone in ambulances in the 1970s did not create a rash of heroin use in the 1980s. So the proliferation of this substance is only good. And in fact, what we should be thinking about is how do we make sure that we're getting naloxone into the hands of people who are going to be around somebody who's overdosing, right? So that we're not just wasting it on people who aren't going to be there. How do we prioritize it to those who are at the highest risk of it? And how do we reduce the barriers to doing that? One of the things that we've recently started up a program is we have so people leaving jails are at very high risk for overdose, but they're also very likely to be around others who are at high risk for overdose. So what we've done recently is we've purchased vending machines, and we've repurposed the vending machines so that they just are free. And we put naloxone in them so that at a jail, so the jail staff, they don't want to be cleaning up naloxone. They don't want to know who's responsible for putting naloxone in everybody's box. So that way, every single person that walks out of there, not just those with opioid use disorder, those who might know somebody with opioid use disorder, can just hit the button and get it for free. So that's the kind of way we're trying to think about naloxone, not just as a harm reduction tool, but how do we actually get people that tool using that same harm reduction philosophy, reducing those barriers, not requiring people to sit through trainings, having it in places where people can access it readily. And in one of those facilities, it fits 150 boxes. There's 2 nasal sprays in each box. And in one of those facilities, in 2 weeks, they cleared the machine out. 150 in 2 weeks gone. So that is the potential to save a lot of human lives.